Hi everyone! Today we're discussing an important hormonal disorder that affects many women worldwide, Polycystic Ovary Syndrome, or PCOS. Specifically, we'll be discussing what PCOS is and how obesity and PCOS can be treated. So let's get started. PCOS is a common hormonal disorder among women, and it's characterized by irregular menstrual periods, excess androgen levels, which are male sex hormones, and polycystic ovaries. Women with PCOS often struggle with weight gain and obesity, which can exacerbate the symptoms of PCOS. So how is obesity and PCOS treated? Well, according to many guidelines, lifestyle management is the cornerstone of treatment, and this includes dietary changes, exercise, and behavioral interventions. So the dietary changes can focus on reducing caloric intake and improving the overall quality of your diet by incorporating more whole foods, fruits, vegetables, lean proteins, and healthy fats, while at the same time reducing processed foods and sugars. Exercise is another crucial component, and we know that regular physical activity helps with weight loss and improves insulin sensitivity, which is often impaired in women living with PCOS. In fact, research suggests that even moderate exercise can have significant benefits. Behavioral interventions, such as CBT or cognitive behavioral therapy, can also be beneficial. These interventions can help address emotional eating if that's an issue, and they can also improve adherence to the lifestyle changes that you've made. In addition to lifestyle management, there's also medications that can help manage the symptoms of PCOS, so let's explore those. First of all, we've got hormonal birth control. So this is the birth control pill or oral contraceptive pill that are often prescribed to regulate menstrual cycles, reduce androgen levels, and they can also manage symptoms like acne and excessive hair growth. They usually contain a combination of estrogen and progestin, but progestin therapy in and of itself can also be used to regulate periods and also reduce the risk of endometrial cancer, which can be elevated with PCOS. Next up, let's talk about anti-androgens. So the most common one of this group is spironolactone, and this medication can also help reduce those androgen levels, which can in turn decrease symptoms like excess hair growth and acne. Third, we've got insulin sensitizing agents. Most commonly used is metformin, which we've seen used to treat type 2 diabetes because it can improve insulin resistance, and it can also help with weight management in women with PCOS and help regulate menstrual cycles. Fourth, we've got fertility medications. Clomiphene citrate, or Clomid, is often the first-line treatment for women with PCOS who are trying to get pregnant because it stimulates ovulation. Letrozole is another medication also used to induce ovulation. It's often recommended for women who don't respond to clomiphene. But what about other medications that we also use for weight loss? What's their role in PCOS? So we know that GLP-1 receptor agonists are a class of medication that have shown promise in treating insulin resistance in women with PCOS. Some of these commonly used GLP-1 medications include liraglutide, or Victoza or Saxenda, semaglutide, or Ozempic or Wegovy, and tirzepatide, also called Mounjaro or Zepbound. So these medications work by mimicking the action of the naturally occurring hormone GLP-1 in our bodies, and this plays a crucial role in glucose metabolism. But how does this benefit those living with PCOS? Well, women with PCOS often experience this insulin resistance that I've mentioned. So that means that can lead to higher insulin levels and contribute to weight gain and other metabolic issues. And these medications can offer a promising option for managing that insulin resistance and the other metabolic challenges associated with PCOS by improving that insulin sensitivity, so they can help lower blood sugar levels and reduce that insulin resistance that we see with PCOS. They also promote weight loss, And this is beneficial for managing some of the other PCOS symptoms because we know that weight loss in and of itself can improve menstrual regularity and reduce those excess androgen levels. Also, these medications can reduce cardiovascular risks. They can lower the risk of cardiovascular disease, which is actually more common in women living with PCOS. Now, it's important to remember that before starting any therapy, you should consult with a healthcare provider just to make sure what the best treatment plan is for you based on your individual symptoms and health goals. So thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health and wellness content. See you next time.